Hi, everyone, and welcome to the special simulcast, the Neil Haley Show and the Cutting Edge Benefits Podcast with our co host, Anthony McMahon. Tom was talking some real deep issues. Now we're going to talk about you're in the grind as the sales manager for ClaimLinx, and you just really see specifically what how people are hurting, especially on the employee level. What is the update today, and what topic are we covering today?
Yeah, so I know we usually talk about small employers, 10 people, 50 people, those type of groups. And, that's our bread and butter. That's who we primarily work with. But as of late, with the cost increase and, the ridiculousness of this entire thing, we're starting to, work with some larger clients as well. And they're sending in their plan documents, and we're having discussions of setting them up with our solution. We've done this with, clients that have multi-hundreds already. It works for really any business. And I wanted to, touch on today some of these larger groups that, they feel like they have these alternatives that can save them money, purchasing power, fully self-funding, doing all these things that because they're a little bit larger, they think are going to end up helping them. But at the end of the day, some of their plans on a cost basis are actually worse than these small employers. So, just kind of wanted to touch on that piece of it and
Okay.
what
All
we're
right,
seeing.
let's talk about that.
Yeah. So I mean, one thing that comes to mind are these groups that are self-funding. So a lot of the time, if you have 150 people, 200 people, what they're doing is they're buying, group stop loss aggregates at, say 50,000 per life, meaning that anything above 50,000, Aetna, Cigna, Blue Cross, whoever, they're going to pick up the tab. And then underneath of that, they're self-funding everything up to $50,000. But for that $50,000 stop loss, they're still paying a premium. It's not that expensive because it's obviously extreme catastrophic coverage. But underneath of that, they're taking on way too much risk. And in my opinion, and the math will back this up, instead of buying a stop loss aggregate of 50,000 a person, they should instead be buying stop loss, from a carrier on a group plan for 10,000 a person. And that should be the maximum. You're taking on way too much risk if you're self-funding at 50,000 a piece. Plus, you're not having somebody manage the plan like us who's going to, do a full audit of the group, understand who's on a high cost drug, who has a health condition, how can we mitigate or, eliminate those costs and get those claims down. So I think a lot of these groups are buying the stop loss, self-funding it, setting it and forgetting it, and hoping that the claims aren't that bad. But at the end of the day, if there's nobody monitoring this and handling it for you when you have this huge liability gap, the cost can actually exceed on a per employee basis, what these smaller groups are dealing with. And you would think as a larger group, you're not going to have to deal with this, but they are. So I know that this market is hurting as well. And this is a new area that we're looking to explore.
Interesting. So why do they do this instead of going with a regular rep in the carrier by
They get
self-funding?
they get talked into it. They think that once they hit a certain threshold, they could start acting like a big conglomerate. They could have the purchasing power, they have the power to spread out the risk amongst all these people. But 150, 200, 250 people in the grand scheme of things really isn't that many. If you have 10,000 people, I think that's an entirely different story. But if you only have 150, 200 people on the plan and you don't have anybody who's working on savings, behind this that's managing it for you, the claims can get out of control and you're taking on way too much risk exposure per life. So,
Yeah, and that's just interesting. I mean, it really, in so many aspects, it's very interesting because you never think about these things. And you never think about, so specifically, I didn't know about self-funding. That means they purchase their own health insurance, they have to monitor everything, and then the potential instead of a group, right? So self-funding. Is that what
so
it means?
they'll still go through an insurance carrier, but basically the way that we're buying the high deductible plans and pairing it with the MERP, we're buying usually, $7,000 single deductibles, $10,000 single deductibles maximum. And then underneath of that, the employer is giving the employees, say a $2,000 or a $3,000 deductible. And then they're self-financing that gap between say 3,000 and 10,000. So their exposure is limited, to say $5,000 to $7,000 per employee. And it's not that large. And most people don't actually cross that threshold. But the people that do cross the threshold tend to cross it exceedingly. You know what I mean? Like if somebody has a surgery, somebody has a pregnancy, delivering a baby, somebody has chemotherapy, these things, they don't cost, $10,100. They cost, 50,000, 100,000, $200,000. They cost a lot of money. So the problem with self-funding is instead of having your stop loss be at 10,000 per life, these groups are having 50,000, 75,000 per life before the insurance kicks in. and they're paying for everything else underneath of that. So when these large claims accrue, they're paying that entire bill essentially cash before the insurance carrier goes ahead and pays, for them because they hit the stop loss. So in summary, they're just taking on way too much risk. And I feel like a lot of these, they're still technically small employers, but employers that are on the larger end of the small employer spectrum get talked into, hey, it's time to self-fund. Your premiums are going too high. But what they don't realize is that they're taking on way too much risk and end up paying, so much in claims and they really don't have to. If they just simply purchased a group health insurance plan, stop loss coverage with 10,000 single, 20,000 family, put a MERP underneath, give the employees the first couple thousand, as the deductible and self-finance the difference, their liability is going to be so much more limited. They're not going to have these crazy claims exposures, and the premiums aren't going to be that much more, if more at all.
And then it's interesting when you look at that, you're like, okay, the and that. So how much do you save? You could save those organizations that self-fund.
I mean, some of the ones I've been looking at, even more than we save the small employers on a, per employee basis. Our average savings is $4,000 per employee per year. On some of these groups, I wouldn't be surprised if it's more like 5,000, 6,000 per employee. And, if it's a 200 person group, I mean, you're talking $1 million plus that, they could be saving if they just set this up in the right way. And the frustrating part is that you could tell that these groups are open to more creative solutions, doing things differently, not just buying a group policy and calling it a day, because they are financing the claims and doing these things that are a bit creative. So it's good that they're able to do that and they're able to think outside the box, but unfortunately, the guidance that they're getting is a little bit too radical in terms of the liability that they're taking on, when instead they should just buy standard high deductible group plan, implement the MERP underneath, limit the liability, cost share that piece with the employees, and limit your exposure. And you're going to save significantly compared to either just straight up buying a low deductible plan, or in this extreme case that we're seeing time and time again, self-financing and taking on all this claims exposure when you really don't have to. Plus, the bigger issue is they're not working with somebody who works based on savings. If they worked with somebody who's working based on savings, every claim is going to be monitored. Every high cost drug is going to try to get a manufacturing coupon card. We're going to try to get disease grants, hospital grants to keep those costs down because we're compensated based on how much money they save. So that's the problem is the incentives at the end of the day.
The incentives. And so the difference between self-funding and going group, what's the difference?
I mean, going group, I mean, a lot of the time they want to offer good benefits. So if they go group, they're going to buy a low deductible plan, like a gold plan, a platinum plan, a silver plan, and the premiums on those are exuberant. They're some of the premiums we talked about, 5,000 family rates, 2,000 single rates, like the really high premiums that we've discussed. And that's the problem there, is that your fixed cost is way too high for what you're getting in exchange. The other end of the spectrum is saying, hey, we're going to ditch that entirely. We're going to get, extremely high stop loss at 50,000 a head. In exchange for that, we're going to get extremely cheap premiums. But the issue there is now you have $50,000 of claims exposure on each life. So, something happens that's 30,000 bucks, that group is paying 30,000 bucks. That's the problem. So, we don't want to be radical in either way. We're not trying to say, hey, take on $1 jillion of claims exposure, but also don't give away this crazy amount of fixed premium cost every month on these gold and platinum plans. Let's find a happy medium where you're limiting your liability in terms of, not getting a super, crazy high stop loss. You're still going to get a high deductible plan, but it's only going to be, say, 10,000 a person. And then underneath of that, use the MERP to give back that gold or platinum level benefit for your employees so that they're getting a great benefit, but your liability is limited on how much you guys are self-funding on the claims fees.
But you see nothing like what you guys do out there when you have conversations with people.
No, because again, people don't work based on savings. They don't put their money where their mouth is. They're just, they sell policies and they get paid by the insurance carriers, and that's how they make their money. They're not willing to say, hey, I'm going to manage this for you. I'm willing to set this up. I'm going to service your employees, and I'm going to charge you fees based on the outcome that you get in terms of savings. No one's willing to do that. So that's why our clients get better outcomes, because we are willing to do that.
Wow. Okay. And if you are a medium-sized business that's interested in working with ClaimLinx, but how can they do it?
Yeah, go to claimlinx.com. There's a scheduling call right there where you can just click on the link and book a call with myself or one of my colleagues. There's also a savings calculator on there as well. So if you're one of these groups that have these, self-funded plans, you could take your stop loss aggregate premiums, you could take your total claims. That'll give you your monthly total cost, plug it in, plug in how many employees you have, which carrier you're with, what state you're in, and then it'll spit out on the calculator, hey, and obviously it's an estimate. We need to do a full analysis to give you real numbers, but it'll estimate, hey, you would on average save Y per month, Z per year. And if the numbers look enticing enough, feel free to book a call and we're happy to help.
All right. Go to claimlinx.com and schedule a call with Anthony today. Appreciate it, Anthony.
Yeah. Thanks, Neil.
That was a special simulcast, Neil Haley Show, and the Cutting Edge Benefits Podcast, guys. Take care.